In your morning medical news, measles vaccine rates have fallen to alarming levels in this country. A troubling new report shows just 68.5% of U.S. children received their first measles shot by 15 months last year. That is down significantly from 77% in just 2020. Only 80% of children had both recommended doses by age 6. Health officials warn at least 95% of kindergartners need full vaccination to prevent dangerous outbreaks. And if you're feeling overwhelmed by life's chaos, you're not alone. As Americans juggle work, family, relationships, everything else, researchers are finding better ways to help us cope. Experts warn about grit gaslighting, when we doubt our ability to handle stress, even as we're being crushed by it. The author of Shatterproof tells CBS News true resilience isn't just surviving chaos, it's transforming challenges into something positive.
If something isn't working, instead of trying to continue to do that and make it through, they actually step back and they say, wait a minute, something is wrong here. My pain is a signal. Some need that I have isn't getting met, and I need to find a way to pivot. I need to find new ways of meeting my needs.
To help focus on your needs when you're overwhelmed, she recommends the 2-2-2 method. Identify what you need in the next 2 minutes, 2 hours, and 2 days. An estimated 2 million people in the U.S. will be diagnosed with cancer this year, according to the American Cancer Society. But new research released today suggests 4 things can lower the risk of dying from the disease. Mandy Gaither tells us what they are.
It's a devastating diagnosis. Cancer can make a patient feel like so much is out of their control. But a new study suggests there are things that can be done to lower risk of dying from an obesity-related cancer diagnosis.
I think that that's a great message of not being able to feel hopeless that, well, I've had my treatment now. It's out of my hands.
American Cancer Society scientist Alpa Patel is senior author of a new study that shows 4 factors that can improve the odds of survival after an obesity-related cancer diagnosis. Avoiding obesity, staying physically active, eating a healthy diet, and limiting alcohol intake. Who mostly adhered to these healthy lifestyle choices after their diagnosis had a 24% overall lower risk of dying compared to those who didn't make as many healthy choices.
Even if you are not perfectly following these guidelines, the more you adhere to them, the better your odds of surviving your cancer diagnosis are.
Patel says that even if a person with cancer wasn't making healthy lifestyle choices before they found out they have the disease, choosing to be healthier post-diagnosis can help them.
It's a great opportunity for clinicians to reinforce to their patients, as well as for patients themselves to know that it's not too late to start after that diagnosis.
The research also found those studied who have cardiovascular disease had a 33% lower risk of dying from heart disease compared to those who didn't choose healthier lifestyles.